Greetings. The topic for today's discussion is Bruxism. So, Bruxism, according to AAPD in 2003, was defined as the habitual, non-functional, forceful contact between occlusal tooth surfaces can occur while awake or asleep. Ramford in 1966 defined bruxism as the habitual grinding of teeth when the individual is not chewing or swallowing. Bruxism can be classified as daytime bruxism and nighttime bruxism. Daytime bruxism is that which is diurnal bruxism, bruxemania, where a patient is conscious or subconscious and it occurs along with parafunctional habits. Nighttime bruxism is also called as nocturnal bruxism, where the patient subconsciously grinds the tooth with characteristic rhythmic patterns of the masseter muscle. The causes of bruxism include stress, central nervous system disorders like manifestations seen in the cortical lesions, for example, children with cerebral palsy or mental retardation, genetic reasons, psychological factors like gnashing and aggressive grinding of the tooth, systemic factors which include magnesium deficiency, chronic abdominal distress, or intestinal parasites, occupational factors like overenthusiastic student and compulsive overachievers may also develop this habit of bruxism, and also occlusal discrepancies because they would have had a filling or something before that, and so occlusion may find it difficult for them. The clinical signs and symptoms include tooth structure defects like occlusal wear, increased tooth sensitivity, occlusal trauma, which includes toothache, mobility in the morning, and muscular problems include tenderness of the jaws, muscles on palpation, muscular fatigue on waking up in the morning, hypertrophy of the masseter muscle, TMJ disorders like pain, crepitation, clicking, restriction of the mandibular movements, jaw deviations. Associated factors include headache and soft tissue trauma. So how do we diagnose this habit of bruxism? We need to take a detailed history and do a clinical examination, check for any occlusal prematurities using articulating paper. Electromyographic exam like hypertrophy of the muscles of mastications can be assessed. So how do we manage bruxism? Psychological counseling have to be given for the patient, like counseling which can lead to decrease in tension, create awareness of the habit, and this will increase the voluntary control and thus reduce the parafunctional habits for the child. Hypnosis, relaxing exercise, massaging that region can also help. Occlusal adjustments like any premature contacts or occlusal interferences which have been associated with the development of bruxism in some studies in past, and hence we need to correlate these factors also. Physiotherapy, some exercises which will help in reducing the muscle pain and stiffness can be practiced. So night guards or occlusal splints can also be used either in a single arch or both the arches. Hard splint is generally preferred so that the wearing out can reduce. Drugs like local anesthetic, tranquilizers, sedatives, and muscle relaxants can be used, but the uses of drugs in treating bruxism should be limited to short periods and only during severe cases we can use drugs for the patient. Acupuncture, there are special pressure points which are there where when we apply pressure, the patient can find relief. An orthodontic correction, if necessary, can be done for the patient to reduce this habit. Thank you.